Hello and welcome to today's tutorial focusing on constipation in infants. Constipation is a common presentation to GP practices. It is characterised by a decreased frequency of bowel movements and hard stools that may be associated with straining and pain. Affected children will have fewer than 3 stools per week, though breastfed infants may pass stools even less frequently, and this is normal for them. The stools may be hard and large or appear like rabbit droppings. In children over the age of 1, overflow diarrhea may be present alongside reduced appetite, abdominal pain, and retentive posturing, where a child appears straight-legged, on tiptoes, with an arched back. Constipation may be exacerbated by pain, fever, reduced fluid intake, reduced fibre intake, issues with toilet training, psychological problems, and concurrent use of medications. Assessment. Red flags suggest a serious underlying cause, and if any are detected, the child should be urgently referred to an appropriate specialist and constipation not managed in primary care. Red flags include symptoms of constipation from birth and delay in passing meconium of more than 48 hours, which may indicate Hirschsprung's disease, abdominal distension and vomiting, which also may suggest Hirschsprung's or an obstruction, family history of Hirschsprung's disease, ribbon stools, which may suggest anal stenosis, leg weakness or motor delay, which may suggest an underlying cause, and abnormal appearance of the anus or lumbosacral and gluteal regions. In the case of constipation, amber flags may also be present, which warrant specialist review, but in these cases, constipation can be treated in primary care whilst awaiting this review. Amber flags are as follows: evidence of faltering growth, developmental delay, or concerns about well-being, which may suggest a systemic condition such as celiac, hypothyroidism, cystic fibrosis, or electrolyte disturbance. Constipation triggered by the introduction of cow's milk, or any suggestion of child maltreatment, which would need to be referred to the local safeguarding team per local procedures. Diagnosis. Underlying causes for constipation should be considered, but in the absence of these, constipation can be diagnosed as idiopathic and no investigations are required for this. Treatment. Reassure parents that underlying causes of constipation have been excluded. Commence treatment with laxatives, but ensure parents are aware that any treatment may need to be continued for several months. Any concurrent impaction must be treated with a disimpaction regimen prior to commencing maintenance laxative treatment. Disimpaction regimes use escalating doses of Movicol, though stimulant laxatives may be required if disimpaction is not achieved within 2 weeks on Movicol alone. Maintenance relief is also with escalating doses of Movicol as required, with the addition of a stimulant laxative such as Senna if constipation is not adequately treated on an optimal dose of Movicol. Laxative treatment should not be stopped abruptly, and children who are toilet training should remain on laxatives until this is completed. Some children may require laxative treatment for several years. If toileting behaviour is contributing to constipation, interventions including scheduled toileting, bowel habit diaries, and reward systems may be of benefit. Recommend a balanced diet with sufficient fibre in children who have been weaned. Formula switches and cow's milk exclusion should not be commenced without specialist review. Ensure fluid intake is adequate. For infants 0 to 6 months of age, they require at least 700 ml of fluid per day. 7 to 12-month-olds need 800 ml. 1 to 3-year-olds 1300 ml, and 4 to 8-year-olds 1700 ml. This requirement increases further into adolescence, with boys requiring more fluids than girls. When to refer. In addition to referral if red or amber flags are present, consider referral if symptoms do not respond to optimal treatment in primary care, or if there is fecal impaction and the child is very distressed. If the child is less than 1 year old, they should be referred if there is no response to laxatives after 4 weeks. Children over the age of 1 should be referred if there is no response after more than 3 months.